Hey drivers, Dr. Nusi here again with an important update video. This is for drivers who have sleep apnea that use a CPAP or a BiPAP to help treat their condition. The FMCSA has just come down with an announcement. They sent me an email. I want to pass along that information to you. Again, this is only going to apply to drivers out there, but there's a lot of you that use a CPAP machine or a BiPAP machine to help treat your sleep apnea. That is a very important condition to control when going in to take any of your medical tests, to keep your CDL, to keep your medical card. All right, so let's get right into the particulars. And again, I'm doing this video as an update. I want you drivers to be informed on when the FMCSA makes changes or makes updates. I don't want you going in to get any of your medicals done and not knowing what's going on and possibly being disqualified, losing your job, or your medical card being delayed or something like that. So please, it's very easy. Stay subscribed to this channel. It's free. All you've got to do is hit the button down below. Make sure you hit the bell as well. And then every time the FMCSA, the Department of Transportation, makes an update, I will make another video. You'll get it right in your inbox and you will know the particulars. All right, so stay subscribed. Let's go into the details. I just got this, so I'm just going to read off the email here. All right, so I'm reading right from the email because, again, this is fresh news even to me. So this applies to drivers using a particular Philips brand of CPAP or bi-level PAP or a ventilator. And this is a recall that is for these particular machines that they have identified potential health risk related to the polyester-based polyurethane sound abatement foam. So it's a foam that goes into the mask component of these devices. Now, what they're saying is the particular foam may pose a threat if it enters the CPAP machine's airway or air pathway, where it then could be ingested or inhaled by the patient when you're asleep. Obviously, that would be a very, very bad thing. The foam may also off-gas certain chemicals. Philips advises that the foam degradation may be worsened by certain unapproved cleaning methods such as ozone. High heat, high humidity environments may also contribute to the foam degradation. So the recall notification advises patients or customers to take the following actions. So this is why it's going to be a big deal for people that are treated with a CPAP or BiPAP machine and go in to take your physical. Again, I've done a complete video about sleep apnea. I'll just link that video right up here at the I button. So if you want to know the particulars about that, but it's very important to have compliance data, meaning you're using your CPAP machine very regularly and be able to show the certified medical examiner that you are using it, and they're saying that there's going to be a recall. So this is why it's important. So for patients using affected BiPAP and CPAP devices, they need to discontinue use of the device and work with the physician or durable medical equipment provider to determine the most appropriate options for continued treatment. To continue use of your device due to lack of alternatives, consult with your physician to determine if the benefit of continuing therapy with the current device outweighs the risks identified in the recall. And then the FMCSA has sent this update to us. The FMCSA is aware of the situation and they expect to soon have some guidance on how to proceed with drivers with sleep apnea and the DOT medical certification process. So when we, the medical examiner, perform a physical exam, all drivers being treated for sleep apnea should be informed of this recall. So that is one of our responsibilities, is when a driver comes in and they have sleep apnea and they're using a CPAP machine, BiPAP machine, we need to be informing them that this recall is out there so that they know it. Now again, here's why this is going to pose a problem. So again, just to go over the broad strokes, the problem comes in is if you discontinue use of your CPAP, BiPAP machine, if you're not using it consistently, then we, the certified medical examiner, cannot technically certify you. We need compliance data. We need a print off that shows you're using your machine at least 4 hours a night, at least 70% of the time. And if there's a break in that usage, then again, we aren't going to be able to certify you. So if you stop using the machine, what they're saying, then the FMCSA doesn't really know what we should be doing. This is what I expect, and this is probably until I find out more information. Again, they say it's coming soon. I'm probably going to do what is pretty typical, and that's give a 1-month certification to allow this kind of all shake out. So we're allowed to give 1-month certification if somebody isn't using their machine appropriately, to give them a chance to use their machine appropriately and get that 1 month of data and then bring it back, and then we can certify them for longer, hopefully. So again, just a real quick update about a pretty important topic that affects a lot of drivers out there. So the big deals here are there's a recall on a very particular Philips CPAP and BiPAP machines, and it's a very important recall. And the problem with that is if you discontinue using your CPAP machine, it makes it very difficult to pass your medicals if you have sleep apnea. Please, again, stay subscribed. When this gets updated further and they tell us what we need to be doing and doing with our patients that come in for their exams, I'm going to pass that information along. So stay subscribed, hit the bell so it goes right into your inbox. All right, thanks a lot, drivers. Until next time, stay safe.